My apologies that this is another video lesson, but I have a parents' evening in our twilight slot and I'm not able to be there. Secondly, please ignore my voice. I don't know if it's coming through, but I've got a cold, so I sound a bit coldy, so my apologies for that. I'm going to skip to slide 26 where we got to with the drug treatments. Okay, this is where we got to. We have typical and atypical antipsychotics. Hopefully you can remember from last time. Obviously give your booklet a read if you've forgotten about your typical and atypical antipsychotics. Our typical antipsychotics are the older ones from the 50s onwards, and atypical are our newer ones. So they were from the 70s onwards. You need to know the similarities and differences between them. Firstly, they're both similar in fact they lower the amount of dopamine in the brain. They both have a similarity in fact that their side effects, tardive dyskinesia, hopefully you remember our video of Jeff, who had uncontrollable involuntary movement of the face, tongue, cheek, and jaw. With the atypical side effects, they have ankylocytosis. This is a reduction in your white blood cells, which therefore lowers your immune system. Not obviously as bad as TD, but there are some side effects that we still need to take account of when we're evaluating. They are both based on the assumptions from the biological approach. And then the differences are the typical antipsychotics only affect dopamine, but the atypical ones can also affect serotonin. The difference, another difference is they have little effect on negative symptoms, the typical ones. However, the atypical ones alleviate both positive and negative symptoms. The evidence for this is mixed, but we can still use it in our evaluation as a strength. That the typical ones have little effect on negative symptoms of schizophrenia, but atypical ones are better because they alleviate both types of symptoms. The last difference is that the typical ones have more side effects because of their mechanisms of action. Remember, dopamine, the typical ones affect dopamine production all around the brain, not just in certain pathways. And that's how we can end up with things like TD, because it's also affecting the pathways of dopamine in the motor pathways of the brain. Atypical antipsychotics have fewer side effects because of their mechanism action. Remember that they start by tightly binding in the D2 receptors, but typical ones stay there and atypical antipsychotics move off, so they do allow some dopamine production. They don't just stop it entirely, and that's what the fewer side effects are caused by. A couple of exam questions now, so I'd like you to get your assessment booklets out and find the questions under drug treatments for antipsychotics. 2 years ago, Jenny was diagnosed with schizophrenia. She's been taking typical antipsychotic drugs. It's worth highlighting and putting the older ones next to that. Refresh yourself of that. There have been improvements with her positive symptoms. However, she still suffers from negative symptoms and side effects. That's something to highlight. Her psychiatrist wants her to change from her medication of typical antipsychotics to one of atypical antipsychotics and suggested CBT as well. Number one, with reference to the item above, explain why Jenny's psychiatrist wants to move on to the atypical antipsychotics for 4 marks. Hopefully you can see that this is just an A1, A2, A1, 2 question. Give me 2 reasons why the psychiatrist wants to move Jenny. You can feel free to pause the video and answer that question now. In the second question, the table isn't actually in your assessment booklets. Hopefully you can see it clearly from the slide here. Remember that these PowerPoints are in Teams if you need them. So what does the data in Table 1 seem to show us about the effectiveness of typical and atypical antipsychotics in the treatment of schizophrenia? A researcher investigated the effectiveness of typical and atypical antipsychotics in schizophrenia patients with either negative or positive symptoms. The table shows the percentages of patients with either negative or positive symptoms responding well to typical or atypical antipsychotics. To go through the table, you've got the number of patients responding well to atypical, so these are the newer ones, and then next to it, the number of patients responding well to typical antipsychotics. You can see that with the newer ones, the atypical antipsychotics, they're responding better. Patients are responding better if they have negative symptoms, 30% to 16%. And then with positive symptoms, it's exactly the same. So going back to the question, it's 4 marks. What does it show us there? You've got 2 bits of data there, how they respond with positive and negative symptoms. You have to make a generalized conclusion about the patients and what we can say, and then how do you know that? Back that up from a conclusion back that up with a result from the table. What does it generally say about patients who are on atypical antipsychotics? What do they respond well to versus typical antipsychotics? Back that up with a result from the table. And then secondly, patients with positive symptoms, you want to be saying that they're responding the same, and again, back it up with a result. Have a go at writing that. Pause the video now, and I'll go through the answers. So for this one, it's AO1, AO2. You could have said atypical antipsychotics have been shown to be more effective against negative symptoms. Typical antipsychotics are liable to produce movement side effects resembling Parkinson's disease. And then you want to be, or you could have continued to say they mainly affect dopamine pathways. Atypical antipsychotics are less liable to produce movement side effects. These are all reasons why Jenny psychiatrist wants to move her on to the atypical antipsychotics. Your AO2 is going to be very similar here, don't worry, but make sure you're doing both. You need for each reason to have said, this is why Jenny psychiatrist wants to move her. This is why Jenny psychiatrist wants to move her. Even if you have to repeat yourself, because the question is very the question is similar for the AO2, really. For the next one, atypical and typical antipsychotics are equally effective against positive symptoms. More than half the patients are responding well. The main difference is in the negative symptoms, and look how they've included results there. Atypical antipsychotics more effective against the negative symptoms, and the findings support that. I want a generalized statement. See how the first one is atypical and typical antipsychotics are equally effective against positive symptoms. That is a generalized statement and then backed up with a result. So that's what I wanted. I needed essentially 2 conclusions from this. Make a comment about something I can generalize to everyone, and then how do you know that? So evaluating, this is a mix and match, and what I'd like you to do is read the piece of evidence, sort them into either effectiveness or appropriateness. Are they telling us the drug treatment is or isn't appropriate? And what could you use to lead into the evidence? Put them in an order, put them into a mix and match. I'd like you to pause the video now and complete the evaluation table, please. Okay, you should have had something that looks like this. You match the colours up with each other. I'm going to go very briefly through this in class. I'm not going to read out this entire slide for you. That's obviously something you can do on your own. Just make sure that you've got the right answers. So some more exam questions. These are very, very similar to the ones we've just done. Number 1 is limitation of drug therapy for 2 marks. We've just done a really similar question. Equally, we have just done an essay type question in our last lesson. You're welcome to do this 16 marker. Type it out for me and hand it in. You still have 5 hours of psychology revision this week, but it's not an expectation to do those last exam questions, just the 2 that we've already been over. I am going to do a bit on the next bit, which is psychological explanations of schizophrenia. So this is going to go over another video. And yeah, I'll chat to you in the next video.